The skin's not supposed to be red. It's not supposed to break out. You're not supposed to have eczema, psoriasis, rashes all over. It's a 60-year study with over 5,000 subjects, 300,000 patient visits worth of data. It's massive, and the vast majority of people have never heard of it. So they've connected in many of their trials skin dysfunction to Alzheimer's risk, to osteoporosis, cardiovascular disease, rheumatoid arthritis.
How do they define skin aging? Is it wrinkles, the number of wrinkles, the depth of wrinkles?
How is the acid generated on the skin to maintain acidity? Where does that acid come from?
What are the things that people think they're doing that are working for their skin that are actually working against it when we consider the microbes?
Makeup can be very disruptive. I do have a solution for makeup. We have the largest probiotic acne trial ever done. 90 days, we saw a 75% reduction in total lesion count.
Hey everyone, if you've ever wondered if having a skin breakout or skin issues was not just vain, but something you should worry about in terms of your disease risk, this is the show for you. We have Kiran Krishnan here, and he's a microbiologist, as credible and knowledgeable and wise as they come, someone I have learned so much from. And we're going to dig into the skin, the microbiome. What are we doing that's hurting it? What do we need to do to support it? And what does the health of our skin tell us about how well we're going to live, how well we're going to age? It's a very exciting time. So welcome to the show, Kiran. I'm really excited
Thank
to talk to you.
you. Thank you so much, Autumn, for having me. And I've always enjoyed our conversations, and this is a topic that I'm very passionate about. So I welcome the opportunity to get to talk to you about it. Thank you for having me.
Yeah, it's really exciting when I've been doing this for 13 years. You see someone like yourself be still passionate after all this time, still creating, still learning, still educating, and it's like it's palpable with you. And your wisdom is so important and has moved and changed so many people's lives. So let's just start there. What you said in one of the webinars I listened to was that our skin, the health of our skin, could potentially predict whether or not we develop disease or how gracefully we age. Talk to us about that. How did you come upon that link, and what do you think that means?
Yeah, it's such an important connection and reshift we all have to make in our mind when we think about our skin, right? So we think about our skin as this outer veneer, and we are very concerned about how it looks because we want to present ourselves in our best possible light to the open world. But what we forget is that the skin is a very dynamic organ, and it has very specific functions. Its main function is to act as a barrier. And if something goes wrong with that barrier, it creates risk, right? So that is hypothetically it already makes sense. Then the question is there data to support it? But I want to give people a little bit more, and I'll share with the data what the data actually says. But I want to give people a couple of different ways to think about it. So our liver is an organ, right? Our stomach's an organ, our colon is an organ system. If we got a scan or a view at any of these organs and we had bumps and polyps on it and rashes and breakouts and all of that, we would be freaking out, right? We'd be like, what the hell is going on with our organ, right? If you have a polyp in your colon, it's going to get removed, right? If you have what looks like acne on the outside of your liver or depositions of fat, you're going to address it. Your doctor is going to be very concerned about it. And so any other organ in the body, if there are significant topical or visual changes to the organ, we really start to get concerned. We just haven't done that with the skin because we forget that the skin's not supposed to be red. It's not supposed to break out. You're not supposed to have eczema, psoriasis, rashes all over. And the goal is not to do topical only things or cosmetic only things to cover those up. The goal is to really understand why those are happening and what the implications of those are. So then, spoiler alert, let me give people the big study that was really the thing that brought me to becoming much more passionate about this. I've always thought about the skin microbiome because I know that anywhere in the body that there's a high density of microbes, it means that they're doing something really important, right? That's true in every part of the body. We really haven't paid as much attention to it on the skin. So I've always been thinking about the skin microbiome and what its role is and so on. Then a number of studies started getting published from this long-term trial called the Baltimore Longitudinal Study of Aging. It's the first and I think the only true longitudinal study on aging, right? What does that mean? That means that they actually took individuals when they're in their late teens and early 20s and in the 60s, and they've been following them now for over 60 years with regular visits and biomarker analysis and risk analysis and all of that stuff. So they've gotten so much more, data and understanding on how the body ages, what drives aging, what drives disease risk, both for mortality and morbidity, and where you can discern those risks and do something about it, right? So there's probably 300 papers or more that have been published from the study, and it's still going. It's a 60-year study with over 5,000 subjects. I think it's something like 300,000 patient visits worth of data. It's massive, and the vast majority of people have never heard of it,
Wow.
right? And so this is my world of digging into this kind of stuff. Here's what they showed, right? They have shown that one of the best predictors of morbidity, which is disease risk, health span, and so on, and mortality, is aging skin.
Mm.
Right? Now, many of us in the wellness space would automatically think, just as I did, well, that makes sense because unhealthy inside is reflected on the skin, and thereby you're seeing the unhealthiness on the inside on the skin, right? What they showed is actually that's not true. The skin dysfunction shows up first and then drives systemic issues. So they've connected in many of their trials skin dysfunction to Alzheimer's risk, skin dysfunction to osteoporosis being a driver of osteoporosis, right? So you can find, for example, psoriatic lesions, so someone that has psoriasis, right? You can find proteins that are specific to the psoriatic lesion in your joints or in your bones, driving inflammation that then damages the joints and bones,
Mm.
right? And the psoriasis comes first in this case. Now, this also happens as a kid. We know that allergies, asthma, and all that are an epidemic, right? It's a massive issue right now with kids in the last two generations. And what we're showing is something there's a pathology called atopic march. What this indicates is that kids who are born with skin dysfunctions, and I'll explain why they end up with skin dysfunctions. It's all our practices, the things that we do. When they're born with skin dysfunctions and barrier dysfunctions on the skin, antigens like food particles and environmental particles and all that leak through the skin. And when antigens are presented to the immune system in the skin, which is not the place the immune system is supposed to sample things and make decisions whether it should attack it or not, it drives a very inflammatory hyperreactivity response. And
Mm.
so kids, for example, with eczema are 8 times more likely to develop asthma, allergies, food sensitivities, and immune dysfunctions, right? Eight
Wow.
times more likely.
And
So again, yeah,
is it
all of
because
that
of it's because of the eczema in
because of the
partially?
eczema.
Yeah.
Yep. So we would normally think like, okay, eczema is just another iteration of their immune dysregulation, but the studies actually show that the eczema comes first and
Mm.
becomes the driver
Mm.
of their dysfunction, right? So we cannot state enough how important it is to think about the skin as an organ. And once we start doing that, we then have to think about what are the most important features of healthy skin that allow it to function the way it's designed to function, right?
Yeah.
So that's where our mind needs to go.
Yes, amazing. So a few things. First, how do they define skin aging? Like, what are we supposed? Is it wrinkles, the number of wrinkles, the depth of wrinkles? Like, take us on that. What should we be watching for to define, oh, my skin is aging well or not aging well?
So what they actually defined, and they're measuring this in individuals, and then they're following it with biomarker analysis and risk analysis and all that. They're looking at fine lines and wrinkles. So both the density, the depth of it as well. So both of those play a role. And now with the AI cameras and all, they can get very good objective measures of wrinkle depth and topography. So fine lines and wrinkles, spots, age
Mm.
spots, right? So dark spots and age spots. So that represents senescent cells. And we'll talk about what is going wrong with the skin in each of these, right?
Mm.
Dryness and thinness of the skin. So as you get older, your skin actually becomes thinner and more dry. And then redness of the skin. So how sensitive it's become over time. And then any sort of clear barrier function, right? So whether you've developed like an eczema or dermatitis and so on. But when it comes to the cosmetic aspect of aging, they're looking at loosening of the skin, fine lines, wrinkles, hyperpigmentation or discoloration of the skin, dryness and thinness of the skin as well.
Okay, perfect. And I have both G's for Alzheimer's. I'm a little bit obsessed. So can you talk a little bit about Is it that same kind of mechanism? Like antigens are getting in a portal or in a way that they're not supposed to. They're inciting inflammation that is going to the brain. Tell us how that works. And are there other disorders besides osteoporosis and Alzheimer's? Or are those just the two with the greatest relationship or the strongest?
Yeah, so in fact, there's lots. Like they basically showed that skin aging and barrier dysfunction of the skin. So this is what I call leaky skin. So I've been doing lectures to clinicians on leaky skin. Barrier dysfunction of the skin is the one of the top, if not the number one predictor of all forms of mortality and morbidity, right? So when we talk about chronic disease, so it's related to cardiovascular disease, rheumatoid arthritis, osteoporosis, and osteoarthritis, Alzheimer's and dementia. So all of the things that we are concerned about in the aging process and conditions that may drive disease risk or mortality risk. Now, let's talk about the Alzheimer's risk for a second. So where the main connection is the overgrowth of fungus, fungal overgrowth on the face and the head, especially, right? Now, at the basic level, what people may experience that as is flaky, dry skin. Some people may get it as like perioral dermatitis. That's becoming much more common now, especially since COVID and since all the masking and all that. And if you know any dermatologists, you ask them how difficult it is to deal with perioral dermatitis. That's all this redness and bumps all around near the nose and the mouth. And of course, dandruff and flaky skin. Men, because men are now, a lot of men have beards now and some degree of beards. So all of the dryness and itchiness and flaking in the beards, a lot of that is fungal overgrowth. And the reason you have fungal overgrowth is because the acid mantle of the skin, that is that very narrow pH range that the skin is supposed to be maintained at, that acid mantle is broken down. When the pH goes up in the skin, you get an overgrowth of mold and fungus. That overgrowth of mold and fungus, like malassezia, becomes a independent risk factor for dementia and Alzheimer's because you're breathing in the spores and the antigens from the mold. It's going right to the brain and it's causing inflammation in the brain.
Oh, fascinating. Now, Kiran, have you had skin issues? Every time I see you, it's like you look like look beautiful. I'm wondering like what ignited this passion before we get into what we're doing wrong and what we need to do to build up our skin. I'm wondering where this come from.
It really comes from following the microbes for me, you know.
Mm.
As you know, in my previous companies, I worked a lot on barrier function in the gut. I did a lot of work in leaky gut. We published numbers of studies. We built products that help with leaky gut, and I think I felt good about the contributions that we've been able to make there because leaky gut is such a big driver of chronic disease risk as well. And then I just started thinking about all the other barrier systems and the role of microbes in those barrier systems. The blood-brain barrier, now that's very closely tied to the gut. The next largest barrier is the skin. And just looking it up and looking if anyone's working on things, I always look on places like clinicaltrials.gov and patent filings and all that to see, is somebody working on this? You know, is somebody making some sort of headway on this? And if they're not, then I start looking at relevant literature to see, is there information coming out showing that this is an important topic? And if nobody's working on it and it is an important topic, then it's my impetus to dive in and start trying to figure something out.
I love it. And what is their relationship? Is there one between the leaky gut and the leaky skin? Can a leaky gut precede leaky skin? Does leaky skin precede a leaky gut? Talk to me. Are they related?
Yeah, so that's a great question. So that speaks to the gut skin axis. And like any other axis in the gut, it's a two-way axis, right? And I can give a couple examples of how a damaged skin or leaky skin can drive a leaky gut and how a leaky gut can drive a leaky skin. It happens both ways. So we do, at the end of the day, have to pay attention to both. And so let's take the skin component first, right? So let's say you've been doing things that disrupt the acid mantle of the skin. So we're over sanitizing. We're using all of these personal care products with things like parabens and phthalates in it and all that, and fragrances. All of that disrupts the skin microbiome and thereby disrupts the acid mantle. If you talk to any skincare professional, they'll tell you that the two big important categories in terms of skin function and structure is the acid mantle and the barrier function of the skin,
Mm.
right? If those two get compromised, then it opens up all kinds of dysfunctions on the skin. So then my question always is to skincare professionals, well, how is the acid generated on the skin to maintain acidity? Because the skin has to be between 4.5 and 5.5 as a pH. That's an acidic pH, right? It's not as acidic as a stomach, but it's about as acidic as a small intestine. And so where does that acid come from, right? Like we know in the stomach, in the GI tract, the stomach is producing hydrochloric acid to acidify things. And we know the microbes are producing lactic acid to acidify things. So where does the acid on the skin come from? Right. And most people don't know that. So where it actually comes from is we make sebum, right? Our skin produces oils and produces sebums. These oils come in the form of triglycerides. So it's your skin is producing, the sebaceous glands in the skin are producing triglycerides. Now, those triglycerides get secreted into the bottom part of the epidermal layer of the skin. Now, we have microbes on the skin that will metabolize those triglycerides into short chain fatty acids, right?
Like in our
And
gut.
it, like in a gut, exactly like butyrate propionate acetate, same short chain fatty acids, right? Now, those short chain fatty acids on the skin not only balance the pH, and that is the mechanism of balancing the pH, right? There's no other way for us to do it. And we know that if the pH goes too high or too low, everything falls apart, right? Just like in our gut. If the pH is too high or too low, everything falls apart. And so, and just like in our blood, if our blood pH changes just even a tiny bit, everything falls apart, right? So
Mhm.
pH is a very, very important control element within all of our body, including on our skin. And we're 100% dependent on the microbes on our skin to maintain that, right? So
Mm.
they're producing short chain fatty acids. And when they produce short chain fatty acids, not only does that acidify the skin, it also helps maturation of something called ceramides. Ceramides are these fatty acids that are the brick and mortar in between the skin cells,
Mm.
right? So you've got all these skin cells, multiple layers of skin cells, but in between them, the mortar is this fatty acid layer called ceramides. Now, the ceramides come from the gut, right? So your gut breaks down things like wheat germ or rice bran and things like that, where you get phytoceramides. So these are fat components from plants. Those phytoceramides are converted to human-like ceramides in the liver and then transported to the skin. But when they get to the skin, they're not quite in the state to be used properly as mortar. What we need then are the short chain fatty acids and the pH to mature the ceramides, right? So now we've got the microbes that are playing an important role in maintaining the acid mantle, in maturing and making functional the ceramide layer. What else functions in that acidic pH? The collagen and the elastin proteins, right? Those proteins function best in that narrow pH range. If the pH is too high, those collapse and you lose elasticity on the skin. If the pH is too low, they can degrade and you lose elasticity on the skin, right?
Mm.
So the protein matrix of the skin is also dependent on that pH. The fat matrix is dependent on that pH. And then overall, the response of the immune system in the skin is dependent on that pH because that pH controls microbial and pathogen growth. If the pH is too high, you get fungal overgrowth and pathogen overgrowth and so on. If it's too low, you get more dysbiosis and you get sterilization of the skin, right? But it almost is never too low. It's almost always too high.
Is there a way to differentiate, like, oh, okay, well, and it's probably all related. Like, I'm having a pH problem. Is there
Mhm.
like, are there like red herrings for a pH problem versus a ceramide problem versus a skin barrier problem? How would we know which one we have?
Well, so that's the thing. You often will have them all.
Yeah.
And it starts with a pH problem. It's just like the gut, right? If there's a pH issue in the gut and you start getting things like bloating, indigestion, and all that, it starts to lead to leakiness in the gut and barrier dysfunction. It's the same thing in the skin, right? So you could see the cascade. The pH becomes imbalanced. As a result of the pH imbalance, you start losing functionality in the elastin and collagen fibers. So you start getting loosening and thinning of the skin. And then on top of that, the ceramide layer starts to break down. When the ceramide layer starts to break down, what starts to happen is water starts to evaporate from the skin. Now, one of the reasons why the ceramide layer is so important and why it's used topically, for example, in atopic dermatitis or in eczema, is because the ceramide layer is the fatty acid layer that prevents water from leaving the skin through evaporation. Right.
Mm.
So it prevents the skin from drying. And as you know, in eczema and all that, the skin gets really dry and irritated because the ceramide layer is broken, right? So you've got the ceramide layer that's maintaining the barrier. So if pH goes off, the microbes get damaged and the pH goes off. Then the collagen, elastin, ceramide layer all break down. Then the barrier of the skin breaks down. Not only do you start losing moisture and the skin gets dried out, but you open up the barrier itself and stuff starts leaking through. And
Mm.
when stuff starts leaking through and it gets into the lower levels of the epidermis and the upper levels of the dermis, you get immune recruitment into that area. That's when it becomes red and irritated and damaged. Now, the crazy thing about that is then that immune action that's going on in the localized area can translate to the rest of the body, and you can find systemic inflammation from that localized inflammation, right?
Isn't
And that
that
systemic inflammation can cause disruptions in the gut.
wild? It's just like our teeth, right? You can
Mhm.
find those same kinds of bacteria in the heart or in other areas, even in the brain, maybe. Well, that is
Yep.
fascinating. I wish I had known this sooner. So, when I did a toner, right? I know,
Mhm.
okay, pH is important, but I'm just going to use a toner. Like, what are the things that people think they're doing that are working for their skin that are actually working against it when we consider the microbes?
Yeah, so the most common things that are probably working against the skin are any personal care products that contain preservatives, right? So we think about the parabens, the phthalates, the benzoates, and most personal care products have to have preservatives in it because they're all water-based products, right? And as a result of being water-based products, you have the risk of growing mold and you have the risk of growing pathogens in there through contamination. And because of that, they have to put these antimicrobials, antifungals, and all that in there. Those are going to be disruptive to your skin microbiome. Also, most soaps that people use have additional antimicrobial function in them, right? So we're killing down microbes even more than we want to. If you look at anything that's fragrant, fragrance compounds are strong antimicrobials and
Mhm.
create barrier disruption. So if you're using a lotion that's fragrant, if you're using perfumes and all that, anything that's fragrant has that effect. Makeup can be very disruptive, right? Because it's pigments. It creates this block, if you will, and you see the makeup dries out over the day and all that. So people use I can't remember what it's called, but you spray on it to keep the makeup moist and so it doesn't crack and so on, right? So makeup can be detrimental. And I think most people know is like if you come home or you go to bed and you don't take your makeup off, you're gonna get breakouts and you're gonna get sensitivity on the skin. Why is that? Well, because it's not actually good for your skin. All of that said, what I don't want people to expect is they stop wearing makeup and all that, right? They're not going to do that. I know that, nor is that reasonable. Now, I would say it is absolutely reasonable for people to start cleaning up some of their personal care products,
Yeah.
right? Reducing the number of things that they use, and then trying to get cleaner versions of them, right? Look at the labels. You know, you can take a snapshot and have Chat GPT read your label and ask you and tell it, are there any, antimicrobial compounds in this label? And it'll point out all the ones that are problematic. So you want to try to get ones that are as clean as possible. I've been doing that personally for myself as well. I've worked on finding the cleanest lotion that would work for me, finding the cleanest deodorant that would work for me, finding the cleanest and simplest soap that would work for me, right? And then other than that, I really don't use anything else except for the skin, the sieves, the skin microbiome serum. And so I think people should go on a little bit of a journey to start cleaning up their personal care products.
Yeah.
On top of that, I do have a solution for makeup that
Yeah.
I think
Oh,
can be very helpful.
oh my gosh. Okay, we'll
Yeah.
do that. We're gonna go into the microbes, but I would like you just share with us. We're gonna talk about your serum in a little bit. I want to get deep in that one, but can you tell us what deodorant and soap are you using and what makeup alternative? There was a point in time when I didn't worry about, I thought it was vain to worry about the fact that my skin broke out. And so I would just
Mhm.
power through and just cake that makeup on. And then as I
Right.
got older, I started to learn that, oh my gosh, this is an indicator that, something is out of balance and I need to. And so I started just, instead of wearing makeup every day, I wear just like a mineral sunscreen that's tinted. So that's really
Yeah.
helped me, like a Clove Hill. That's the kind I use. And whenever I'm done with the interview, like I take my makeup off, like let my skin breathe a lot more. So that's what I do. But tell us, what are just your super basics? And then we're going to go into the microbes and skiv.
I found this year, and I've tried so many deodorants, and deodorants will be kind of subjective because it really kind of depends on your own, chemistry and all that. But the one that works really well for me is one that's called Salt and Stone.
Mm,
I don't know if you've heard of that one, right? It's
I've
pretty
heard of it.
basic. You can get it on Amazon or any other place. What I don't like in terms of fragrances are things that add volatile oils, which is most fragrances are contained within volatile oils, right? And those have a detrimental effect to the microbes on your skin. This one has, for example, sandalwood, and sandalwood is a different type of fragrance in it, and it's very light. So I use salt and stone on the skin. I've been using it's called the body cream by Beauty Counter. Are you familiar with Beauty Counter?
Yes, yes,
Yeah, it's
yes.
called Body Balm. I think they rebranded it recently. It comes in a tub, and I really love that product. It's really creamy and but light enough where once I put it on, it absorbs well and it doesn't feel like it's occluding anything.
Mhm.
And I can get very dry after I shower. For me, so I have to put it on right after I shower. That works well for me. And then for my soap, I found a bar soap by Kiehl, which has a number of different options. But I use a bar soap because it's much more simple and it has a little bit of an exfoliant in it, but it doesn't have a whole lot of, the ingredient list is much cleaner than your conventional kind of bath shells and all that. And bar soaps don't have to have the same antimicrobials and all that because it's not a water-based product, right?
Yeah.
It's a dry soap. So you don't have to have all these phthalates and parabens and all kinds of stuff in it. So those are the three things that work perfectly for me. And then of course the only other thing is a sieve on my face and body for me.
Yes. Oh, I'm so excited. So I do the same thing. I only do the pits and the parts with a bar of soap, and I've like stripped down my routine. I am a bare basics kind of lady these days.
The other thing about that, though, which is great, is it allows our pheromones to come through, right?
Mm.
So one of the things we do is we use all these fragrances. Like my kids, for example, I keep trying to wean them off all of these smells, right? They come out of their room and I swear I could see an aura of fragrance around them, right? Between the bath gel and then the perfume and the this and the that. The thing about all those fragrances is not only, of course, can it be endocrine disruptive and all of the negative stuff, it also blocks all your pheromones, all your natural pheromones, right? And pheromones are so important in terms of connectivity with people and getting that oxytocin kick. Like I'm a big hugger, as you know, anytime I've seen you, I give you a big hug. And there's an aspect of that. Not only is there a physical connection that's good, but you also get like a little bit of dose of people's pheromones. And if it's a positive relationship, that pheromone gives you a little bit of a boost of oxytocin, which is really healthy for all of us. And then, of course, for intimate partners and all that, that takes it to the next level, right? So the more natural we can be with that, the better. But I know we're not all going to be hippies and, just coat ourselves with mud. We need something, but we want to be as minimalistic as we can.
I love that. And I'm gonna throw my husband under the bus because it's like when people have these very strong scents, it's almost like it's like offensive to him. He's like,
Yeah,
oh my gosh, and maybe that is just like interfering with his ability to kind of like sense the person on another level. Who knows?
totally.
But okay, now the skin, microbes. We know trillions of bacteria, so much
Yep.
more bacteria than cells. So tell us,
Yep.
what does that makeup of bacteria? What does it look like on our face? Are they resident
Mhm.
microbes? Are they moving around? Give us the lay of the land, and then we'll talk about the serum and how we can improve it.
So there's very distinct ecologies on the skin. We can break it down into just basically two parts. So your body and your face. Now, one thing that the skincare industry has kind of inadvertently gotten right is different types of products for the face versus the body, right? And as it turns out, the microbiome of the face and the body are very different.
Mm,
So on the face, it's a very sebaceous environment, meaning a very oily environment. We have bigger pores on our face as well, which means that between the oil and the bigger pores, we have a lot of anaerobic environments. So areas where there's no oxygen at all, right? And it seems kind of crazy because we're out here in the open air,
mhm.
but a lot of
Yeah.
these creps and depths and pores in our skin have no oxygen, which
Mhm.
means that there are very few microbes that can proliferate on the skin. You need to have a microbe that does well with metabolizing oils, but then also does well in an anaerobic environment. The category of microbes that does well in that case are called Propionum bacterium.
Mm,
And Propionum bacterium tends to be the predominant class of microbes on the face, and you actually have very low diversity on the face. You don't want high diversity on the face. If you have high diversity on the face, it's a sign of skin aging and dysfunction. The
mm,
other microbe on the face that's predominant is Cutibacterium acnesis. Used to be called Propionum bacterium acnesis. Now, people might guess based on the species name, the acnesis, that it has something to do with acne, right?
yeah.
And in fact, it does. What's so interesting about this organism is it's one of those. commensals that are natural resident microbes on the skin, just like commensals in our gut, that play an important role. But sometimes you can have a serotype or a version of it that has the potential to develop some degree of pathogenicity, right? They're not infectious because acne is not an infection, it's an inflammatory condition, but they do things to trigger an inflammatory response, right? So I'll give you an example of that. So you could have Propionibacterium bacterium acnesis on your skin, or Cutibacterium acnesis is what it's called now, on your skin, and it does a lot of good things. It actually maintains the pH of the skin. It competes against dysfunctional organisms. It helps skin cells turn over. It can produce enzymes that break down dead skin cells and slough off so protease enzymes that allow new skin cells to show up. So it's a natural exfoliation of the skin, which is important. Now, you could also have the version that goes deeper into the pores and under the right condition can drive an inflammatory response in the pores. Now, what are those right conditions?
Yeah.
The right conditions there happen to be stuff that starts in the gut, right? So there's a very close tie to what's happening in the gut and then the risk of developing acne lesions based on the type of Cutibacterium acnesis you have on your skin. So a few of the things that are drivers, right? Number one is diet. There's about 52 studies on the impact of diet on acne, and what they find in general is that is things like gluten and dairy do increase acne risk for people who are prone to acne. There's lots of people that can eat gluten and dairy and not have any acne, but if you're prone to acne because of the type of Cutibacterium you have, that can be a trigger. We also know that leaky gut is an amazing driver of acne. If you have high levels of LPS, even more than gluten and dairy, more impact than gluten and dairy, high levels of LPS will drive the formation of acne lesions. In fact, there were studies done where they took individuals who are highly prone to acne, who have had breakouts and all that over time, and they're controlled to a certain degree. They took them off the controls, whether it's the antibiotics or whatever they're taking. They gave them things that drove an increase in LPS in circulation. And what they found in all of the subjects where LPS increase, they developed inflammatory lesions on the skin. And in all of the subjects where LPS levels stayed low, even though they are at risk of it, they never develop inflammatory lesions, right? And so I actually have a US patent on how to modulate the gut microbiome to reduce acne lesion risk quite significantly, right? So that's where that rationale comes from.
Okay. What is that? Like,
Yeah,
is that going to be available soon? Is that
it is. It's actually
upcoming product?
a product we have within Civ. It's a probiotic. It's called Biome Balance Within.
Mm.
And it's got two good large-scale randomized control trials. In fact, we have the largest probiotic acne trial ever done, and then a
Break
US
it
patent
down.
that
Yeah,
protects this.
break.
Yeah. So here's what we saw, right? So this was super exciting. We took people who are, and this is non-cystic acne, because if you go to cystic acne, it becomes a disease, right? So, and then you're dealing with a drug according to the FDA. So it's a non-cystic acne. These are people with frequent or occasional breakouts, and this was done at a dermatology research lab. What we did is we did a randomized controlled trial. We had people on placebo and, of course, people on the probiotic, and we did a 90-day study. The reason why we did a 90-day study is all of the antibiotic acne studies are 90 days, right? The doxycycline studies and all that. So we wanted to benchmark against what kind of results you get from the antibiotics. Now, if you look at all the antibiotic studies, right, the typical reduction in the 90-day period is around 60 to 70% of total lesions reduction, which is good. That's a profound reduction, but of course you're paying a price for it, right?
Which
Your
is
guts dismantle. Yeah, your risk of a whole bunch of other stuff goes up. Depression, suicidal ideation, all kinds of crazy stuff goes up because you're on really strong antibiotics for 3-4 months. Now we did the same exact protocol, same exact randomization with the probiotic. 90 days, we saw a 75% reduction in total lesion count, right? And
wow.
their guts became healthier. The side effect that people reported was, hey, my digestive system feels better and I'm pooping better. And like, we're okay. So we have a better option, right? We don't have to atom bomb these people in order to get rid of your pimples. We can actually make them healthier and get rid of the zits and
My
make them prettier,
favorite.
right?
I love
Which is
things with,
so easy. Yeah.
yeah, I love things with side benefits, right? Instead of side effects, you call that a side benefit.
Side
Well,
benefit.
That's incredible, Kiran. I don't think I even knew you did that trial. So is there one trial? Now tell us what microbes are in there. How did
Yeah.
you discover them? Take us through that.
So these are the spore-based probiotics as well that I've been working with for a long time. They are the Bacillus endospores. Two of them in particular do a lot of the work. It's the Bacillus subtilis and then the Bacillus indicus. Now, the reason why those two do the most work is when I was looking through the mechanisms around likely what will change and move the needle in acne from the gut, what became clear is that if you can increase acetate production, which is one of the short chain fatty acids, right? So we have butyrate, propionate, and acetate. If you can increase acetate production, especially over propionate, you get acne and skin benefits. Now, why is that? Well, everyone knows about butyrate and all of the importance of butyrate. Butyrate does most of its function in the gut and in the digestive tract, right? It doesn't go outside of the digestive tract very much. Propionate does go outside of the digestive tract to some degree, but acetate leaves the gut the most.
Ah,
And acetate goes throughout the body. It has two functions. It has antimicrobial functions against dysfunctional microbes and anti-inflammatory functions as well. So what we find is that if you have an increase in acetate systemically, you're going to get a reduction in inflammation in the sebaceous glands and a reduction in the amount of sebum that's produced.
mm.
Right. And we verified this. So we did gut microbiome analysis in the study. We showed an increase in acetate production. We showed an improvement overall in short chain fatty acids, but acetate production went high. And then we also did topological analysis and saw that the sebaceous glands were smaller and then they produced less sebum. So we made that connection. That was part of the whole patent filing. So we were able to show this clear mechanism by which you can absolutely modulate the health and appearance of your skin just through the gut alone. And I actually did that before we started developing the topical version of it. And then the combination is like an amazing one-two punch.
Oh my gosh, I'm excited. So Bacillus subtilis, this is interesting. I know you were a meat fermenting guy before, right?
Hmm.
And
Yeah,
I swear, when we first tested our fermented beef sticks, when the water activity was a little higher, that was one of the probiotics I believe we found in there. Can you eat
it is.
Bacillus subtilis? It is. And can
Oh,
you
yeah.
expect, and so that would increase those acetate productions most likely, right? From fermented meat. Are there other foods that are fermented that you think would be particularly impactful for skin health?
Yeah, and the problem is most of them are foods that we don't commonly have access to. For example, the best is natto, the
Yeah.
fermented soybean from Japan, right? So that is a Bacillus subtilis fermentation. Sometimes there's other species in there, like amyloliquefaciens is another version of subtilis that also does that fermentation. Like your sticks, for example, probably has a mix of the two because they're very, very close cousins, and they both do amazing things during fermentation. They produce a lot of peptides and the acids like dipolonic acid and all that that really calms the gut immune system and has all these systemic benefits. Other ones are certain types of cheeses. In Northern Europe, you get fermented cheeses that have high levels of bacillus, and then also as a result of that K2 and so on. So it's really hard to find in North America and the Western world an actual food that has the right fermentation with bacillus. So supplementation becomes the right way, with the exception, of course, of your product, which is actually the first thing that drew me. I remember first conversation we had that drew me to your products is the fact that your sticks are fermented and fermented likely with bacillus. You know,
Yeah,
it's
that's
it's it's a perfect combination.
yeah, thanks for saying that because yeah, most meat products or things in America are made with shortcuts. And that means the traditional
Yep.
fermentation is thrown by the wayside. So thank you for that. I was wondering. Now take us to the topical, right? How important are
Yep.
spore-based? Why are spores important? And what are the bacteria? Is it the bacillus too in the topical? Tell us about that.
It is. It's the bacillus as well, but in a different version of it. We wanted to engineer, and engineer is the wrong word because we didn't do any sort of genetic change. It's really about the condition in which we formulate it in, because it is in a spore state, but we actually want a certain percentage of the strains in vegetative state, which is not in its spore state, which means effectively it'll likely die when you put it on the skin, right?
Mm.
Which is okay. We actually want that because in that vegetative dead state, it has a postbiotic-like effect in terms of modulating immune response. And we're seeing that across the board, both in our studies and, of course, in all the use that we
Tell us
see.
what that means,
And so
that
to go back,
postbiotic. Yeah, tell us what that means, that
Yeah, so
postbiotic
that
state.
postbiotic response. So actually, this goes back to that part of your question that I didn't completely answer. The state of the skin microbiome. So we mentioned on the face, you want low diversity, and there's unique microbes like Propion and Bacterium because it's anaerobic and it's oily. So low diversity, oily skin, and most of the other microbes that end up on your face are transient microbes that come in from the environment. Of course, we're touching our face constantly, so we're touching things and then touching our face. Those microbes hop on and tend to hop off within hours or sometimes days. Now, the difference between the face and the body is on the body, you have much higher diversity, right? It's the dry areas of your body. So the diversity on the body is really high. You could have up to 1,000 different species that live on your skin, on your body, right? And you want diversity on the body. When diversity starts to lower on the body, you start to see aging and dysfunction occurring on the body. And the diversity on the body is higher, but you still get this combination of resident microbes and transient microbes. And what's really important about transient microbes is that some transient microbes are the key to effectuating change in the resident microbes themselves, right? Especially when the resident microbes become imbalanced. And just think about the natural connection with this, right? We are designed to be in the outside environment and not covered up head to toe with multiple layers of clothing, right? That's not how we evolved. So we evolved to be in this constant osmosis with the outside environment where we're picking up lots of microbes from the dirt and the rivers and streams and each other and so on. And those microbes are jumping on, doing a job, and then they jump off. Similar to the gut, we thought about the spores as a potential transient microbe that could effectuate a change on the skin itself. It's not colonizing and living on the skin. What it's doing is it's jumping on and then it's eliciting the right type of immune response on the skin, which is the immune system is primed to look for signals from certain transient microbes because we outsource, our body outsources all kinds of signaling needs. In the gut, half of the digestive signaling is outsourced. We can't induce those signals ourselves. All of the repair mechanisms for the lining of our gut are outsourced to microbes, right? Because we don't have enough genetics to effectuate all those change ourselves. Same thing on the skin to maintain the pH, to maintain the barrier, the ceramide layer, the collagen, the elastin, the skin cells themselves, they're turning over the skin cells, the induction of the apoptosis within melanocytes. So melanocytes are the cells that make melanin, the pigment in your skin, right? We all are familiar with age spots and darkening and hyperpigmentation. What is that? Well, that is senescence. Senescence are cells becoming zombie cells. They don't die. They just sit there and produce pigment without needing to produce pigment, right? Melanocytes are only supposed to produce pigment when they get stimulated by UV radiation. And then they produce just enough pigment to block and deal with the UV radiation, but they're not supposed to sit there and just continuously produce pigment where it becomes dark, right? That is a sign of senescence. But the thing is, in order for that cell to die and change into a new melanocyte or melanosome in that case, you need a microbial signal on the skin. So signaling on the skin is such an important thing. And what we found was that bacillus, especially in a certain conformation where a certain percentage of the cells are vegetative, they provide that signaling, right? And you'd asked the question about the postbiotic effect. So
Yeah.
what is that? So a postbiotic is now defined by the FDA and the regulatory bodies as a dead bacterial cell that has a known signaling impact on the body, whether it's metabolic signaling, immune signaling, neuroimmune signaling, whatever it may be, right? But it effectuates a signaling component. And our body's designed to use microbes that way because microbes have all of these complex structures in them and on them and so on. And so we get used to this idea of microbes coming on and that becoming a signal for effectuating change,
Mm.
right? So what we found was that the bacillus spores, not only are they a fantastic probiotic to consume, if I make the right mix, I can get acetate up and fix the skin from the inside, at least in the case of acne. But if I formulate it in such a way, I can actually use them topically to affect profound change on the outside of the skin as well.
Oh, well, what a dream. Because I suffered from acne my whole life and it was so awful and it stole my confidence. I didn't want to do Accutane because obviously there's many risks there. I didn't want to do antibiotics. I didn't want to wreck my gut. I wish I had known about this sooner. So tell us, how do we use it? Actually, I want to say, I've had two of my friends use it, and for very different applications. One was just like an aging condition in the skin and
Yeah.
breakouts, and she said it was life-changing. And then second, someone who had cradle cap in their little,
Yeah.
it worked beautifully. So tell us, what is like the most remarkable change you've seen in someone using your product, and how would you use it for best results?
Yeah. So we have both studies, and then of course we have real world evidence. And the real world evidence in many ways to me is even more important, right? Because studies are much more controlled and all that. We have inclusion, exclusion criteria. You can't use this, you can't use that, and so on. Real world, people are using all the things that they're using and doing what they're doing, and still it's causing a massive positive impact. So the most dramatic impacts we see are with anything inflammatory on the skin, especially things like, eczema, psoriasis, so that red, angry, dry, flaky skin. The thing that's been the most heartwarming is seeing that positive effect on babies and young kids, because eczema and dermatitis is an epidemic among kids. And this is also why allergies and asthma are an epidemic, right? As I mentioned, the eczema becomes an independent risk factor for creating allergies and asthma and all that. And the thing is, pediatricians really struggle with it because there's no treatment. The only treatment is steroid creams,
Mm.
right? And many parents are savvy enough to know that they don't want to start down that path of steroids because they're going to be putting it on their kid for the rest of their life,
Oh,
right? Because the steroids do not deal with the root cause driver. And so we've been very, very excited to see that we have literally thousands of cases of pediatric, dermatitis, eczema type of conditions, that it works amazingly well for. And in a very short amount of time, we're talking about profound changes in 6, 7 days,
wow.
right? And then if you do it for 20, 30 days, it's completely changed the topography and the health of the skin. Acne, of course, we did a 300 subject study on acne. And of course, we have thousands of cases as well. We saw 98% of the subjects saw a significant reduction in acne
Wow.
lesions, right?
Wow.
98% working across the board, which is so
Wow.
exciting. And then we just finished a study because we did this study because we got a lot of reports from estheticians and skincare professionals, but we just did a study on dark spots, so pigmented spots and age spots, right? And we saw a significant reduction in 28 days in of using Civ once a day in this case, on the face, on dark spots and pigmentation. So
Wow.
think about it for anything that where your skin is red, sensitive, damaged, itchy, bumps. We have lots of great results with keratinosis. We have lots of great results with rashes. Like people put on bug bites and
Mm.
rashes, anything where the skin barrier has become damaged and becomes inflamed. Right. That's like the bread and butter. Now, of course, for those that are very health minded and just want to be preventative, we do have some cases and results on fine lines, wrinkles, and of course, the pigmentation and just the topography of the skin,
Mm.
right? Just getting smoother skin, better tonality, and all that. We have lots of those cases, and we have some study data as well. And then with makeup, as I mentioned, so let's talk about the uses of the product, right?
Yeah, like do you do it
Um,
once a day? What time of day? And then do you continue using it if there's no more irritation, or do we cycle it in seasonally? Give us all those.
Yeah, yeah, those are important. So it comes in this type of, so there's two sizes. There's a 15 ml, which is what this is, and I don't have the bigger one in front of me. It's 30 ml, so you can imagine it's a little bit bigger than this. 15 ml lasts an individual about 30 days if you're using it on your face and neck. And basically the way you use it is you actually will, and you probably see the spores settling at the bottom. Right.
Hmm.
So
Hmm.
we this product has no water in it. It basically has four ingredients, right? So it has three oils that are skin mimetic oils, very thin, very light oils. So there's no fragrances or no preservatives or anything in it. And then it has the bacillus spores. Now, the reason why it settles is because we did not want to add more ingredients in there to suspend them and create emulsions and all that kind of stuff, right? So what individuals need to do is they have to take the bottle and then they shake it up. when they get it. And when you shake it up, then the fluid just becomes cloudy like this, right? So you don't see it settled anymore. It just becomes cloudy. And then you take your dropper and so you wash your face. And before you put on moisturizer, you can, if you use a toner, you can wash your face, put on the toner. And before you do, you do the moisturizer, you take a couple of drops from the dropper. And then usually you just kind of pat it on your hands and then you gently just rub it all throughout your face and neck. Usually 2 to 3 drops is plenty. It goes a long way. Some people put it directly on the skin and then rub it in. And it's nice when the skin's just slightly damp still, to add it in. So once you've washed your face, don't completely dry it. Just pat dry it down, which is probably good for you anyway. You want to let the skin kind of air dry a little bit more than aggressively wiping it down. Then add the probiotic and then, sorry, not the probiotic, the serum. It's definitely not a skin probiotic, but it's a serum. And then add the moisturizer on top of it. So
So,
that's the basic use.
okay, so tell me, why is it not a skin probiotic?
The word probiotic is a little bit misleading. It's misleading because probiotic has a assumption that it's colonizing and it's living on your skin.
Okay.
And we know that it's not, right? So we're very careful not to use that term because we don't want to mislead people into thinking that we're putting something that's living on their skin. It has an impact on your skin microbiome. We have data to show this, but it's not acting like a probiotic like you would think. It's not going and living on your skin, nor do you want that. Right. And that's a part that's kind of bothered me a little bit about a lot of the other skin probiotics that they're calling out there. Now, more often than not, they're using conventional lacto gut strains, and then they're just calling it a skin probiotic when it's not at all normal for
Oh.
those species to be on your skin. Right. Now, bacillus is completely because it's a ubiquitous environmental organism. You find
Right.
it on you, in you, and everywhere, on your meat sticks and everything, right? It's naturally everywhere. It's a ubiquitous environmental organism. And as a result, it's completely normal to have it on your skin. But when you have companies that are taking gut-based lactobacilli and calling it a skin probiotic, it's misleading.
Hmm.
And I want to make sure that consumers don't feel that. Because here's the other thing, the reason why they call it a probiotic, I think, is because there is a assumption of efficacy with probiotics, right? Because probiotics generally people feel good about them. Like, oh, you got to take a probiotic. You take it, it's going to do something positive. So if you call it a skin probiotic, it makes a general assumption that it's going to do something beneficial for your skin when you don't know that until you study it or test it,
Right.
right? You don't know that it's actually going to do anything. So that's the basic use. Now, I mentioned something about makeup. People are not going to stop using makeup, nor should they. I want people to feel as good about themselves as they can. And makeup is important in that light. My sister is a professional makeup artist. She works in Hollywood movies and TV and all that, right? So she's been doing makeup for 30 plus years.
Nice.
When I first introduced this product to her, she looked at it and she kind of played with it and she goes, "Hey, that would be a really great what's the term for the thing you put on before makeup?"
Oh, a
My mind's
primer.
a primer. Yes, yes, yes. Thank goodness you remembered. I was like, "What the hell is that term?" And so she goes, "This will probably work great as a primer," because she uses primers all day long. Because these actresses and actors and all that are wearing makeup for 14 hours, and then
Yeah.
she has to keep going and spurting them and all that so they don't get dry. So she uses primers. And I said, you know what? If it works as a primer, that's phenomenal because think about you're adding a layer of protection before you put on the pigments and all that can be disruptive to the skin. And then when you come home and you're done with the makeup, you don't need to have it on, wash it and clean it off, and then put another layer of sieve on. So we had her do that. She
Hmm.
tested it on set because there were also a couple of actresses that she was working with that actually had really sensitive skin. So those 10, 12, 14 hours of makeup would make their skin really red and irritated. So she started using it as a primer and she found it to be amazing, not only to protect the skin, but as a primer itself. It works really well, right? Because it keeps the skin moist and it keeps the makeup from cracking and irritating and all that. So I would also look at using it as a primer, which means you're using it in the morning, likely, right? So again, same thing, wash your face before any sort of moisturizer or sunscreen and all that. I would add the sieve on right under the makeup, and then anything else you might put on top of that. And then in the evening, when you come home, you can also wash off your face and put another layer of sieve. The other use of it is like if you have these irritated dry patches, dermatitis like patches on the skin and all that, you add about a drop to that area. The guide I give people is for a region that's about the size of your palm, right?
Mhm.
So if I had like a bunch of redness and eczema here on my palm, on the back of my palm, so I'd add about a drop or two in that area and just rub it in once to twice a day.
Mm.
I would start with once a day and just make sure that it feels good and all that. And then if it's helping in the first couple of days, and you'll notice something in just the first couple of days, then you could bump it up to twice a day, once in the morning, once in the evening, in order to accelerate the effect. Right.
Amazing.
And the same thing with, if you get bug bites, razor burn, sunburn. We have lots of people use it for sunburn,
Mm.
right? You can mix it with your lotion and rub it on, or you can put it directly on any part of the body as well. So it's so versatile and easy to use.
Yeah, I love it. And I love that primer tip. That's genius. And yeah, my friends, and I've used it too, and my friends do. They use it for everything. It's kind of like
Yeah.
Windex in that movie, My Big
Yes.
Greek Wedding. It's just like whatever you got going on. So this seems like the thing that makes all of our other products and all of our other habits work better, right?
Yeah.
So what are a few, like three evidence-based things? Like I do some red light for my skin,
Mhm.
or there's maybe other products or PRPF, or are there other things we can do for our skin that are natural and that are going to support the skin barrier outside of the city?
Yeah. Yeah, absolutely. So a little bit of UV exposure in itself, right? So sunlight is good for the skin. Too much sunlight can be, of course, problematic. But sunlight in itself can be. Red light, as you mentioned, has some really, really good data on skin health. And the other thing I would think about, and depending on how aggressive you want to get with improving the skin, is microneedling for the skin.
Yes. Yes.
Right, and I would look at small needles, so not like the 0.25 millimeters, just enough so that you're getting some sort of, really it's trauma to the skin. But the thing is, both for red light and for microneedling, you need the microbiome of the skin to be balanced in order to effectuate the repair. Right,
Hmm.
because both from red light and microneedling, it's the repair phase after the
Hmm.
exposure to the red light or the microneedling, which is where the benefits come from. But the skin can only repair itself appropriately if the acid mantle is appropriate, if the barrier function is appropriate, if the right microbiome is on the skin, and you don't have an overt inflammatory immune response on the skin as well, right? So think of red light and microneedling as like a stimulus
Hmm.
to induce repair. But in order for the skin to be able to repair, it has to be relatively healthy and balanced from a microbiome perspective, right? So this will definitely help all those other things work even better.
I love that. And my last question, and then tell us where we can connect. And I think you have a code or a discount for us. So this is just a purely selfish question. And I don't know anyone as smart as you. Here it comes. There is this thing that I have where if I have garlic, and it's not all
Mhm.
alliums, it's just garlic, I will get breakouts just on my nose, deep ones that hurt. Why? Why my nose? Why garlic? What is happening? Do you have any idea?
Yeah, I think so. There may be a couple of different reasons for that. One of them is so you said Allison. Can you use Allison as a supplement?
Yeah, no, I've never tried, but like I can
Okay.
eat onions and every other allium containing
Yep.
like yeah, it's not an allium thing. It's specific to garlic.
Garlic contains the highest levels of allicin.
Mm,
And allicin is a very strong antimicrobial.
mm.
And in some individuals, that strong antimicrobial can create lots of disruptions in their GI tract, and you may not feel that in your GI tract, but then any change in your GI tract can be presented throughout the rest of the body as well, right? This is why, an oral antibiotic does work to control like cystic acne on the skin, because an antimicrobial effect in your gut actually has a profound effect on your skin. So it may be the antimicrobial effect of the allicin itself that is in the garlic, which is at very high concentrations. Now, there's also some question around the bioavailability of allicin from garlic versus any other source of allicin. And we know this to a certain degree because if you eat enough garlic, you can actually smell it on your skin. So you don't smell, for example, ginger and onions and all that in the same way coming out of people's skin. And that may be a factor of the bioavailability of the form of allicin that's in the garlic in itself that gets past the liver and into circulation, thereby being able to smell it, and even in your case, impacting the sebaceous gland and the microbes in that part of your skin. But that's super interesting. Some people, like in certain Hindu religions, for example, they don't eat garlic at all. They
Wow.
consider garlic, so garlic is considered like a devil's food, if you will.
For
Right?
me,
And
it is.
yeah, it is, right?
For me, it is. Yeah.
And as a reason, and that may be one of the reasons, because maybe there's a certain number of people that ate it way, way back when and had both GI and skin effects and all that, and they're like, oh my God, it's cursed food,
Yeah.
right? So they don't eat it at all. So that's so super interesting
It
that you
is. And
have
I was
that.
wondering about the nose specifically. Is it because there's these cracks and crevices, or any idea why in the nose?
Yeah, yeah. So some people just have much bigger pores on their nose,
Okay.
and
Yeah.
the sebaceous glands in that area produce way more sebum than
Got it.
anyone else. This is why you get all those really interesting white heads on your nose that you could squish that you don't see in other parts of the face. It's because of the pore size in
Okay.
itself. Now, what's interesting about that, I would actually ask you to challenge this. We know from a few case studies that we've done that the use of sieve on the face can shrink the pore size, right?
Mm.
So you should use sieve on your nose, particularly in your nails. Like use 1 to 2 drops on your nose for like 20 to 28 days, and then eat some garlic and see if you get a breakout. Let's see if it actually changed some of the mechanisms in that part of your face to see if it actually changes how your skin now responds to the presence of garlic.
Oh, you are on because I got to tell you, all my favorite foods have garlic, right? And
Yes,
it's
it's so
just so
tasty.
hard not to eat. So, yes, in the name of science, I will do it. And so, tell us where we can get it. I highly recommend this product. Like I said, you don't do things that aren't research backed. Every
Yes.
product I've used from you comes from this extensive knowledge base and research that you're conducting about your actual product. So, tell us where we can get this product and about our discount code. And just thanks for all the work you do.
Yeah, absolutely. Well, thank you so much for having me. You can anyone can get the product at www.sivcare.com. So it's SIVCARE.com, and definitely use the discount code Paleo. You get I think it's 15% off on that. And I think that coupon code is on all the time. So just keep using it for your next orders and second orders and third orders. And just keep in mind that we have the 15 and the 30 ml bottle. If you have a desire to use it both on your face and your body to a certain degree, then the per ounce value of the 30 ml is better. It's about 15 to 20% better. So you add the code on top of that, you're getting the whole thing for like 30% off. So think about the 30 ml bottle as well. The other way I use it, I'll spot use it on parts of my body if there's irritated areas and so on. But I also put 2 or 3 drops in my lotion, and I
Mm.
before I apply the lotion on my body, and then on the face I just use it directly as well. And a lot of people use it on the scalp as well. If you have an irritated scalp, this dropper makes it so easy to just part your hair and then drop a few drops and then rub it into your scalp at night before you go to bed. So if your scalp is dry, irritated, you've got that itchiness, absolutely use it on the scalp as well.
What if somebody has like chronic nail fungus in like feet or
Yep.
hands? Would it also be helpful there?
It would. We have a lot of people that have used it on like athlete's foot and
Great.
toe fungus. Yeah, that works amazingly well as well because you're directly driving an immunological competition against the fungus, and you're changing the pH. If you have a fungus, it likely means the pH is altered in that part of your body because you need a higher pH for fungus to grow. So the pH has gone above 5.5, right? So you want to make sure you're rebuilding that acid mantle, compete against the fungus and rebuild the acid mantle so it goes away. And then you had asked me one more question I didn't quite address. You said once all of the things that people are targeting go away, should they keep using it? Right. The way I think about it is that we are doing so many things to disrupt our skin microbiome on a regular basis, things that we basically cannot get away from, right? So we can't get away from all the pollutants in the air. We can't get away from washing too much. It's hard to get away and stop all of those things. So as a result of that, I like to think of this as like a one thing that's supporting the microbiome of your skin that you're doing, right? So ongoing use, there's no issue with it at all. But I think people would see a lot of benefit with using it somewhat regularly.
Awesome, Kiran. Well, thank you so much. Like I said, everyone go check it out. I'm going to start my 28-day journey any day. And if you have any final last words, now's your time.
Yeah, one of my big passions and Civ is a big first step in this is how do we make people look better by making them healthier,
Ah,
right? We have so many ways of getting our skin to look better, but in a fake veneer-like way, right? We can do injections, we can do, harsh stripping, we can do plastic surgery, we can cover everything with makeup, we can do all of those things. That's where technology has gone, that's where innovation has gone is how do you cover up the dysfunction so that your skin can still look better? My whole goal is how do you look better by becoming healthier? And
mm,
we now know that the skin is such an important organ. And if it doesn't look right, it means that there's something fundamentally wrong, which not only affects how you look, but it will affect how you feel.
mm.
And so we want to address both of those things. And ultimately, if you want the biggest, impact on resilient skin, do the probiotic from within and do the sieve from outside, right? And that code will work for both. So that it's called the Biobalance within, and then the sieve serum, the Biobalance serum. The combination is killer for people.
Okay, well, I will put the links in the show notes. And again, thank you, Kiran. Life-changing stuff as always. I truly appreciate all the work you do.
My pleasure. Thank you, Autumn.